Flattening the curve seems a long way off. The state has reached another sobering milestone, a new record number of cases, and more unvaccinated people have lost their lives from this outbreak. An elderly woman and 2 elderly men have died in Sydney. Another 356 people have the virus. Only 102 are confirmed to have isolated for the entire time while infectious. The government says too many people are still breaching the health rules in parts of southwest Sydney.
The COVID emergency has become so dangerous in some parts of Sydney, the Premier has this warning.
There is a high chance now that you could get the virus.
For the first time, there are more than 200 mystery cases. In total, another 356 people have been infected. Despite this ugly reality, there's no change in strategy.
Part of the challenge we have in New South Wales is because of lack of compliance.
So more police are being deployed to hotspots like Canterbury Bankstown.
If they complied with the rules and the law and they applied an element of common sense and a modicum of decency to the rest of the community, we would be fine.
I think it's really unfair for the government to continue to blame and tarnish the Canterbury Bankstown community, 370,000 residents, with the brush of not being compliant or lacking any decency.
Some locals say it's a fair cop.
Well, it is a bit intense. There is a lot of people still in the street.
From my point of view, about 90% people there are following the rules.
More than 80% of today's cases have been found in the 9 council areas of concern. 71 are in Canterbury Bankstown.
Give us the health advice so we can work with government, but all I hear from government at the moment is radio silence.
3 people in their 70s and 80s have died. One of the men caught COVID at the Liverpool hospital. He's the 6th patient to lose his life in that outbreak.
The exposures occurred on a geriatric and neurology ward, and these patients are receiving the best possible care. But sadly, many are older and have health conditions which leave them very vulnerable.
Vaccines are providing protection for the vulnerable in aged care. 4 residents have the virus in Bexley, but all of them have had their shots.
On a day of records, there is one that offers a glimmer of hope. More than 98,000 people rolled up their sleeves for a jab. Looking at the line here in Lakemba, that vaccination rate's likely to accelerate.
Healthcare workers may not have a choice. The Health Minister wants to make vaccines mandatory for them.
Health ministers don't always get their way immediately. I have initiated discussions with the unions.
Time isn't on the government's side. Kathleen Calderwood, ABC News, Sydney.
There are calls for tougher restrictions to stop people travelling from Sydney to regional parts of the state. The Sydney man who went to Byron Bay and triggered the lockdown there was infectious for more than a week, and now his children are also infected. Leah White joins us now from Lismore Base Hospital. Leah, health officials have revealed some possible exposure sites.
Juanita, there are now 5 venues linked to this family, and they include the Pharmacy and Food Works at Bangalow, Harvest Cafe in Newrybar, the Japanese Kitchen in Byron Bay and Byron Bay Woolworths. People who were in these places at specific times last week must get tested and isolated. The entire region is now on high alert. A region plunged into lockdown and aghast at how COVID arrived here. A man in his 50s travelled to Byron from Sydney, inquired about real estate and has since tested positive. Now his 2 children have too.
It just seems a really complacent, negligent act from what I can make of it. I mean, it's not signing in using your QR codes, not even believing in COVID, 4 days sick before you're so sick you have to go to hospital. It's just outrageous.
The lockdown is being enforced in 4 local government areas across the region.
That gentleman was infectious in the community for upwards of 8 days, as was potentially the children as well.
Police are looking extremely closely at what he was doing in that area.
Should it be the case that any breaches of the public health order have been made, then appropriate action will be taken.
Police say they've stopped nearly 400 vehicles in the state's north. Further south, 6 people have been fined after around 40 attended a party at Charles Sturt University in Wagga Wagga.
Hopefully they just learn their lesson, and a $1,000 fine is the worst that results from it. We hope we don't get infections.
Liberal Upper House MP Catherine Cusack says the repeated breaches show placing trust in people isn't enough, and a ring of steel needs to be put around Sydney.
It just seems insane that all of this work is being done to contain the virus in Sydney, and these loopholes continue.
In the Northern Rivers, testing numbers have lifted.
We need lots of tests. People need to come out.
We've been a bit too casual here in New South Wales, and probably particularly in Byron Bay.
13 new cases have been recorded in the Hunter region, but there are no new cases in Tamworth or Armidale. Regions will be hoping the lockdowns do their job and stop the spread. Leah White, ABC News, Lismore.
The state's chief health officer has admitted that officials failed to realise the extent of the spread of the virus in southwest Sydney leading up to the lockdown. Kerry Chant and the Health Minister have fronted a parliamentary inquiry into their handling of the outbreak so far. Dr Chant also says she's given no advice on whether any restrictions could be eased at the end of the month. Here's state political reporter Ashley Raper.
The Health Minister went from facing the media to being questioned by his parliamentary colleagues and made his feelings known about fronting an inquiry at this time.
I actually thought it was a ridiculous proposition in the middle of a pandemic. You're holding us up here while we should be doing the work that we need to do.
The Chief Medical Officer also devoted an hour and a half of her time.
The question was put to Dr Chant, and if you would allow Dr Chant to answer.
I will answer the question that I'm now talking about, thank you. I mean, not up to you to determine who's going to answer the questions. I'm the Minister.
Given that millions of people are in lockdown at the moment, and it's very difficult for everyone, we're trying to understand what happened.
But any advice and then decisions about lockdown or restrictions remain confidential.
We've provided a lot of that advice through crisis cabinet processes, so I'm not sure that I can specifically release those.
We're not going to release crisis cabinet documents or cabinet documents to you. If you want to be part of the government, join the government, but you're not.
There was one admission. In June, a person connected to the Bondi cluster infected others at a West Hoxton birthday party. And authorities didn't realise the extent of the spread from that event in the days before announcing the lockdown.
With the benefit of hindsight, I think it's very clear to see that there was a greater risk of the seeding event in southwestern Sydney than was appreciated at the time.
As expected, there are also many questions about emerging from lockdown and where the Premier's 50% vaccination target came from to start easing restrictions. Dr Kerry Chant insists 70% would have to be reached for any significant changes, and she hasn't suggested what could be done at 50%.
I have not provided specific advice about any restrictions I would be prepared to ease. It is too premature.
I think it's fair to say that the Premier is trying to give a sense of hope.
Hope is hard at times like this. Ashley Raper, ABC News, Sydney.
Ashley Raper is with me now. Ashley, the Greens and Labor didn't seem to get the answers they were looking for.
No, they didn't. Their aim was to hold the government to account at a time when government decisions are having such a profound impact on people. One thing they really wanted to get to the bottom of was how much of the health advice is followed by Crisis Cabinet when deciding restrictions and what other factors are at play, including politics. Now, they weren't successful in lifting the lid on Crisis Cabinet's decision-making processes, but the pressure will remain, especially on the Premier, to better explain her approach. We're 7 weeks into lockdown. Case numbers are higher than they've ever been. The death toll is rising and the government says it has no plans to tighten restrictions. We're in a holding pattern, Juanita, and the government isn't being clear about what modelling it's using to inform its decisions and what the plan is going forward.
Ashley Raper reporting there.